everyone, welcome back to my YouTube channel. I am with my beautiful, wonderful patient, they all are, and I love a case like this because it's minimally invasive. If we have a look at the before photo, we can see that there's multiple gaps in the teeth. These are called diastemas, that's the technical term for them. And we did a course of Invisalign. Now Invisalign, because I always talk about it, is a series of plastic trays. They're clear aligners that you wear 22 hours a day. You change them every 1 to 2 weeks depending on your case, and all the gaps eventually close up. Now it's really important that careful planning is done because in some cases you can't close the gaps up completely because they're too big and you need what we call restorative work. Restorative work is when we add bonding or veneers, and in this case we just need to do minimal edge bonding. Edge bonding is when we add to the edges of the teeth, not the full surface of the tooth, because she has really healthy enamel. We do the procedure under rubber dam, so you're going to watch me do this today, and I know you always ask me questions, but we're going to isolate the teeth and then I'm going to show you step by step what is done. So give me 2 minutes and we will get to the next stage. So we isolated the teeth with the rubber dam to ensure that there's no moisture problems, any breath, anything that could potentially affect the bonding. So after the rubber dam is placed, we also aerabrate the teeth with the airflow, as you can see. And then what we do is that we paste something called silicone in the back of the dam to ensure that things are properly isolated. You can see it's the green stuff at the back. And then what we do is that we acid etch the teeth. We use something called phosphoric acid, which is also known as etch, and it alters the enamel slightly to ensure that it can accommodate for the bonding. After that, I wash it off and then I use something called a primer. Then I use the bond. Once that's done, I hand sculpt each tooth and I separate it so they don't get joined together with the silver metal strip, as you can see. So I've got to polish the bonding down a bit, and there's quite a bit of excess. So one of the big reasons people get gaps between their teeth is because they've got a prominent frenulum. The frenulum is the skin that attaches from underneath the upper lip to the middle of the teeth, and we can see as well there's a little bit, because of the way the teeth have come together, the gums are a little bit overgrown in some areas. So I'm going to use something called the diode laser, which is basically going to just tweak the gums a little bit where the gums have overgrown. It shouldn't hurt. We give a little bit of local anesthetic and it's a bit like cutting the cuticle. Okay, you ready?
Yeah.